looking at the hemoglobin levels, looking at the iron, all of which requires testing, right?
Yes.
And then the whole H. pylori thing. I mean, not everyone's going to be testing for H. pylori. So when are the indications? Just exactly what you talked about, all the symptoms. Are you tired? Like, whether you start off tired first thing in the morning when you roll out of bed and like you have to hit that snooze button like 1,000 times, or maybe you actually have that pep and you jump up, but then later in the afternoon, you're like, oh my gosh, like, you can barely keep your eyes open. So I just find that tiredness is like this thing that kind of can eat away at us. And Dr. Tanya Wild and I want to speak about this because it's so common. Do you find that for yourself, with your patients?
It is so common, but also we need to address what is normal levels of energy. Because I think some people think that they're low energy, and because they expect themselves to get all these things done in a day and still have energy by the end of it and not expect to feel tired. They're up at 5 o'clock in the morning and they're tired by 9 or 10. I think that's normal. Like, you've been going all day. You shouldn't expect to have to push yourself, especially if you're a mom and you're raising kids and, you're working out and preparing food. So I think, as long as you're not dragging your heels or crashing in the afternoon, needing a nap, I think that's, it's normal to be a bit tired at the end of the day so that you can unwind. You know what I mean?
You know what? I really love that you raised this point, because I think in our superhero culture, there's this expectation that we need to be on from the moment we open our eyes to when we hit the hay. Right. And so you're right. Like, it's normal and to be human to experience, ups and downs in our daily life, right?
And our life cycles.
In our life cycles, absolutely.
In our menstrual cycles, in the seasons, because there's constantly this change, right? And we are going to have more energy in the summer and the spring. That's normal.
Yes, that's right. Right. Like the actual sunshine, when we know this, right? When we have sun shining into our eyes, it actually does something to our physical body, our physiology, and it does provide us some energy. And then people that live in the Northern Hemisphere that has longer winter hours, like, Northwest Territories, what is it? Like an hour of daylight in the winter? Like, it's going to be a natural way of feeling that you're more tired.
Yeah, 100%. I think it's really important, however, if someone is really dragging their heels and perhaps they're getting sick chronically, like every couple of months they're catching a cold and, their kids are sick. Sure, they're bringing home viruses, but they're getting every single virus that their kids are getting, perhaps. And so then you want to dig deeper, or perhaps they are sleeping and the sleep hours are really long and they can't function unless they're getting, 9 or 10 hours of sleep. But then there are cases too where I have had patients where, I had an example recently where she's a teacher, she's busy, she's got 3 kids, and she's on all the time. And she's like, I just want to slightly increase my energy because sometimes I feel a little bit tired. But her ferritins, we're just going to talk all about iron today, and her ferritin was very low, and her hemoglobin was 80, which is very low. And I would have expected someone really exhausted and napping all the time. So it's very variable, and also in how you present yourself symptomatically.
Yes.
But I think the bottom line is that everyone really should be assessed lab-wise if they're feeling like kind of suboptimal for themselves, just to make sure that they're not, there isn't a reason one day all of a sudden they wake up and their hair is falling. When it comes to iron, if your ferritin is less than 80, as an example, you might lose your hair a lot. So there's other symptoms that come along with iron deficiency. And if you're chronically low in iron or hemoglobin, which is basically the protein in the middle of the red blood cell that binds iron, then, you can get brain fog, and you can feel sleepy, can't focus, and you can even have sleep disturbances. Your periods can be wonky because of it. And you can even present as somebody who has issues with weight loss, which is a big deal because people are constantly trying to improve their weight, but you can kind of present as someone who has like almost like an underactive thyroid when you have iron deficiency. So sometimes patients will check their thyroid and it's completely fine, but meanwhile, it's their iron deficiency is the issue.
So then let's you talked about lab values. So let's give everybody the actual lab values. So what's the normal range, and then what is abnormal?
So it's funny because the range varies depending on the lab you go to.
Exactly.
So the range, and it's not concrete. So some labs, there's two competing labs in Ontario. One lab says 5 to 300 or like 272. And then the other lab is like 11 to 250 or something like that. Like it's just variable. So I think the bottom line is that medical journals will say if your ferritin specifically, which is your iron stores, are less than 40, then you really shouldn't be jumping to an antidepressant or, medications for anxiety before addressing your iron. Or perhaps if you are addressing your anxiety temporarily while you're building your iron, because iron deficiency can also show up as anxiety and low mood because of the low energy. So a ferritin of higher than 40 is a good aim to have. And then if you're losing your hair, dermatologists will say, aim to have your ferritin above 80. And I've read, journals written by hematologists, and they say it's very variable to how a person will present. And there's different cutoffs. And so you're not just looking at ferritin, you're looking at hemoglobin. So the range for hemoglobin, ideally, I like to see it above 130, but the cutoff is usually 110. You want higher than that. And so that patient that I had that had a hemoglobin of 80 and her ferritin was 4, that's like frank anemia, meaning like she's not just iron deficient, which is kind of like the first stage where your iron stores go down. That's the ferritin. It's like your hemoglobin also goes down significantly. That's iron deficiency anemia. And then you're looking at causes, like why is a person iron deficient? Are they having heavy periods? Are they having a hard time absorbing the iron? Are they vegetarian, or all of the above? Right? So perhaps the absorption is a factor, or the vegetarian and they haven't been focusing on getting sufficient iron from their foods. Maybe they're eating leftovers from their kids, pizza crusts. And
yeah. And I think this is a really, really pertinent point. So let's look at the vegans and vegetarians, because it can be a common deficiency that we find. And so, for whatever reason, they will stay a vegetarian or vegan. So what do we do with that? Like, what's your top 3 interventions that will help them?
So for sure, I will look at so we'll talk about nutrition in a second, but I will want to address their menstrual cycles. Because if they have heavy menstrual cycles, so they're losing iron through
yes,
periods that are heavy,
that's right. Yes.
Then I'll say, well, at the very least, we need to address that, and then we can focus on, like, if you're not, going to become a meat eater, which is totally support. I was a vegetarian until I was 26 and also anemic the first half of my life.
Right.
So if you're going to stay a vegetarian, we'll talk about foods, but let's address the period. So I'll do cyclical progesterone. So we'll help higher doses of progesterone, 300 milligrams, the second half of the menstrual cycle, to try to reduce the heaviness of the period, if that makes sense for the individual person, or I'll send them for acupuncture and herbal medicine to regulate them. So send them back to alive, right? Because that's helpful. And then,
yes, thank you for saying that, because that's something that we certainly do. And we talked about this in our other episode when we talked about Chinese herbal medicine. That's episode number 31. And we were speaking to the fact that, using Chinese herbal medicine can help to regulate the menstrual cycle as well. So when it comes to heavy blood flow, we want to mitigate that, because that's not normal, right?
Yes.
We want, too little of a flow, too excessive of a flow. It's not ideal. So we want it somewhere in between. And there are lots of interventions that we can use. So thank you for addressing that.
For sure. And then nutrition, you can increase your iron consumption by getting more dark green leafy greens. So being a healthy vegetarian. So spinach is really high in spinach and dark green leafy vegetables like kale and Swiss chard are higher in iron. And then the dark legumes, so black beans, adzuki beans, the dark kidney beans, versus, like, let's say the white white lava beans, or, so basically the dark legumes, and then dark quinoa even has more iron than light quinoa. Pumpkin seeds. So trying to up the total iron through nutrition and having more balanced meals, because sometimes patients who are vegetarian will kind of be more carb heavy. So it's kind of focusing on more of a Buddha bowl approach, where it's like you're having a certain portion of healthy carbohydrates that might be the legumes that are dark and the quinoa that have that iron. And then you're having your green veggies, and then your protein might be tofu or tempeh. And that has a little bit of iron. So, the other thing is supplementing. So looking at making sure that if you're really iron deficient or anemic, taking an iron that sits well with your stomach, having it with lemon water or vitamin C to maximize absorption, and not having it with, say, coffee or diuretics, like, tea with caffeine, kind of separating that and separating it from other medications like thyroid or dairy and calcium to try to maximize the absorption. And then looking at the different types of iron, because some patients do really well with a glycinate form, and then some patients might find that upsetting for their stomach. There's, the iron gluconate, which is very constipating in some people. So it's just a matter of finding the right type. I really like the heme kind of iron, which originally would be like what you would get from your meats, but you can get in supplement form. So heme iron structurally maximizes the absorption. So it's just a matter of finding the right kind and then sticking to it, not just saying, okay, well, I'm going to take it until I'm finished the bottle and then I'm good. It's a good idea to check your hemoglobin and your ferritin stores quarterly. So every 3 months, to make sure, because every 3 months we get a new set of our blood cells. And so it's good to see, like, how is this impacting me? And am I getting enough iron stores? And checking at the right time of the menstrual cycle, because let's say you are a menstruating woman and you have low iron, and then you check in the beginning of the cycle 1 month, but then the next month you check before the menstrual cycle. That could change. It might look like your iron is doing better, but really you just checked before you had a whole month to build your iron. So you want to check at the same time. So if you check day 3, check day 3 the next time. So it's a matter of.
That's a great tip. That's a great tip. I of course, I forgot. I'm like, yeah, of course, that totally makes sense. And I didn't think of that, right?
Right. Or you might think, oh, this isn't working, but really the last time you checked just before the period, and then the next time 3 months later, maybe the hemoglobin went up, but the iron stores are down, or, and you just lost blood for a period because you're now checking just after a period. So again, just keeping it on point. And then if you're a menopausal woman and you're not a vegetarian and you're iron deficient, then I'm definitely looking at, obviously, nutrition, a balanced diet, making sure you're getting sufficient protein. Perhaps you're not a vegetarian, but you're just forgetting to eat protein because you're, maybe like you forget and you're eating like a tea and toast diet, for example, or it could be absorption, issues. Like perhaps you've got H. pylori. It was so fascinating. I had this one patient who she had low iron and she was postmenopausal. And she didn't have digestive issues, but I happened to see her husband as a patient. And then I said, let's check to see if he has H. pylori. And then I was like, okay, let's check you for H. pylori. And the whole family had H. pylori essentially.
Wow.
And so then we corrected her anemia, her daughter's anemia, and then her husband, we all treated they all got treated for H. pylori.
It's so interesting. I find that why are so many people getting H. pylori, do you think?
So back in the day, ulcers were because of stress and because of, not eating properly per se. They would have counseling sessions with their doctors. And then they discovered this bacteria really impacts the gastric lining. And I think part of it is, it's immune system and, we are a very busy culture. So people's immune systems get run down, and it's not a sexually transmitted disease, but it is something that you get from sharing a cup or kissing. So it's something that you can pass on to somebody else that you're living with, and it overgrows. It's considered what we call kind of a commensal bacteria, that it can exist in low levels and you're fine. It's more of a matter is that if it overgrows, kind of like yeast or candida. So like you hear a lot about yeast infections in women, for example, but you can also have it elsewhere. And that can if your immune system is run down, then you're going to overgrow that bacteria, that fungus or that yeast.
And I love it. We're going to do another episode,
yes,
on yeast and all that and vaginal,
bacterial vaginosis.
Yes, thank you. I'm like BV. I just say BV.
Sisters. BV, yes. Yeah. So I think that I guess theoretically, it's always been there. H. pylori may just be because of the culture, but I don't know. I actually don't have the answer to that question. Why is there more H. pylori? I do know though that treating it helps with building iron stores. And so if you have somebody who's not menstruating and they're low in iron, you want to look at that. You want to look at celiac disease, make sure that that's not hiding out, that their immune system is attacking their villi in their intestines, little hairs that allows for absorption of nutrients, including iron and B12. So if you find somebody who maybe has like normal bowel movements, we often think about celiac disease as somebody who has diarrhea and anemia, so low iron and pale and tired, but you can have someone with a very light case, like they're even constipated. I've had patients, I've discovered celiac disease because they had cystic acne that, wasn't hormonal. It was all over their face. And we uncovered food sensitivities doing a test. And then I saw, oh, well, you know what, let's do it further step and check the gold standard next step, obviously to a gastroscopy where they go down, but the anti-transglutaminase antibodies, and lo and behold, it was positive. So the gold standard blood test, you could say, for celiac disease, and it was positive. We took out gluten and her skin cleared up. It was amazing.
Awesome. So I think I was actually thinking about this morning. I'm like, we need to have an episode on what's the poop scoop. No, the scoop on poop.
On poop? Sure. Yeah, that's a 100%. Great title. Love it.
All right. So we're going to do that because it's important to know the health of your bowel movements, because people it's like the last thing you even want to focus on. It's like, ew, yuck. We just want to evacuate and like pretend it never happened. And so, but we really need to actually know our bodies, because it gives us so many signs and signals of what, if we're balanced and healthy and when we're not. So like, we want to teach you guys how to look at your poop. Okay. And the other thing that you mentioned is like, okay, treat H. pylori. So are you speaking to, like, let's just use antibiotics because it could be like really horribly strong, or are you also addressing it with other natural methods?
Yeah, so I generally speaking recommend kind of a protocol for good bacteria to kind of put up a nice little army in there of good bacteria to outweigh the H. pylori while waiting for the treatment from, for example, their medical doctor, the tri-pack or the Tetra Pak. So it's like a pretty intense regime that medical doctors will prescribe. I cannot. I have over the years tried to treat H. pylori naturally with no success, or very limited success. There have been some stories, but I can count on my two hands how many.
Yeah.
So I generally say, you know what, like, unless you want to have this bacteria, which could ultimately lead in small numbers to Barrett's esophagus and then, esophageal cancer, which is scary. You don't want to have bigger things when you could treat it. I'll usually say it's up to the person, but generally I'll recommend that they treat it conventionally with antibiotics.
Thank you so much for this. And I think this is what separates us as, more mature practitioners than those that are just starting out. And so for those of you who are listening and are in a place of, gosh, I can't stand, drugs. And listen, I don't like drugs either, but there is a time and place. And for something like H. pylori, both Dr. Tanya and myself, and, all of our practitioners that are alive, we know that, there's only so much we can do. Like, listen, any medicine, there's not one medicine that's omnipotent. Like, it can't treat everything and in all cases. So when it comes to H. pylori, it's like, yeah, you got to do that Western conventional medicine. Like, that's just going to help you, because I will not want you to sit with it for years and years and then have your health go south. Right.
Yes. And here's the thing, that when you take the Tetra Pak or the tri-pack, this group of medications of antibiotics to treat H. pylori, it is pretty harsh. So I actually recommend stopping any supplements or anything else. Instead, take the probiotics before and after, so the good bacteria, and dietary and lifestyle changes are very supportive. And then also understand that if you've been prescribed a 3-month course, for example, of a proton pump inhibitor, which is something that blocks stomach acids, you can get rebound reflux, which is where we play a role to help patients kind of wean off of it. They're often not directed, and they might not have even had reflux to begin with. And then all of a sudden, they're like, maybe they just had iron deficiency. So they take this medication. Now they have reflux because they've been on a medication to treat H. pylori, because H. pylori does not survive in an alkaline environment. So that's why you use an antacid like a proton pump inhibitor. But then all of a sudden you now have this reflux you never had. So we can support patients to kind of get rid of that.
So just so that people understand what reflux is, can you tell us what the symptoms are?
So it feels like heartburn, pressure. Sometimes you'll feel like acid into your mouth even. So proton pump inhibitors basically block that acid production. But then once you stop the medication, rebound reflux is when all of a sudden now because you've stopped acid formation, there's an excess of acid formation and it goes up. So like in our stomach, we produce acid to help break down food. So it's very important, specifically protein. If you don't have enough, maybe because you're stressed or you're in fight, flight, freeze all the time, then that can be a problem too. So low stomach acids is an issue, but too many stomach acids or having meals that are too big and really pushing out lots of acid. Sometimes people will get that reflux, nothing to do with medications, just, that's a problem. And H. pylori will often create that feeling as well. It feels like an ulcer or like pain and like a raw feeling and like you want to eat to get rid of it. It's like an ulcer in your stomach feeling. And sometimes it's only gastritis, which is inflammation of the stomach lining. It hasn't led to an ulcer yet, but they all are very similar. Some people say, oh, it feels like I'm having a heart attack. Like people will often mistake the feelings of a heart attack for, instead of it being heartburn, like, or stomach issues. So it's always nice to say, but the good news is you're not having a heart attack. It's stomach pain, gastritis, possibly an ulcer, and we can deal with that.
Awesome. And by the way, for those of you who are listening or watching, Tanya has helped treat my mom, and it's been working very well. And of course, yes, I'll do the acupuncture nerves as well. So awesome. Everything together has been really helpful because she was a mess prior to all of it.
Amazing.
So yeah, I just want to share that with you. And now, to circle back about fatigue, we're talking about energy. So we're looking for more energy. And of course, when you're feeling like crap, pardon my French, it is like draining energetically. So it's like, how do we get you back? So to kind of like, wrap it all up, looking at the hemoglobin levels, looking at the iron, all of which requires testing. Right?
Yes.
And then the whole H. pylori thing. I mean, not everyone's going to be testing for H. pylori. So when are the indications? Just exactly what you talked about, all the symptoms?
Yeah, the stomach pains and, dyspepsia, indigestion issues with breaking down food. And if you're not having any digestion issues, it's more if I'll kind of ask somebody in their family, anyone have H. pylori? So if they have a really low iron and they don't have heavy periods, these are the things you're looking at. Like, is it you're just not getting enough intake of iron through your food? Are you losing it somewhere, either through your digestive tract or your flow, or are you just not balanced? Or maybe you're an athlete and you're sweating it out, or you're a child. Infants often struggle with iron deficiency as well because they'll often, in some cases, just don't have enough iron intake through food because of selective eaters. I don't like to call them picky eaters. I say selective eaters.
Right.
And they'll overconsume dairy, and that'll kind of not allow for getting enough absorption of iron. If they're, always having cheese with everything, it competes for the iron. Or perhaps they're just not meat eaters, or not getting the greens. It's either one or the other. You got to get the lentils and the greens and or the meats. Otherwise, you're not getting sufficient iron. If you're always relying on milk and cheese, you're getting lots of calcium and protein, but not enough iron.
Oh, I love this. And so really, it's like looking at the continuum of your life. So when you're trying to conceive, making sure that your iron and your hemoglobin stores are high, so that when it comes time, when you're pregnant and when you have postpartum and when you have a child, you're also going to keep the levels up for both you and future baby or baby, right?
Yes. And interestingly, this motivated me, and it's not fear mongering. I'm just sharing that when you have anemia in pregnancy, that does increase your risk for autism in children. So that kind of made me go, okay, you know what? I'm going to work really hard. Yeah. On making sure I get sufficient ferritin, like my ferritin goes up. Yeah.
So if there's an article,
I don't know if oh, sorry, go ahead. Mm-hmm.
No, I was just going to ask if there's an article, we should totally share that.
Yeah.
In regards to
because I was like, well, you know what, if I'm going to feel good and I'm going to make sure I, don't like harm, I guess, the baby's nervous system, is probably just to do with nervous system. I'm sure there are many factors, but that really made me think, okay, I got to make sure that all my patients' iron is good going into pregnancy and through pregnancy. So it's not just about mom, because I'll often say, you know what, babies are the best human parasites, whatever, whatever you're eating, it doesn't matter. It's just do your best, because especially if you have the nausea and vomiting. But this was one scenario where I thought, okay, let's make sure at the very least, if someone can't take a prenatal, let's make sure we're targeting the foods. Like if they're too nauseous to consume a prenatal, that they're getting enough iron through their meats. And then maybe they have meat aversion. Well, then let's find an iron supplement, maybe away from the prenatal, and take the folic acid and iron separate, because iron can be very upsetting to the stomach. So it's kind of one of those, catch-22 situations. If someone has stomach issues and they're anemic, how do you get the iron up, right? So that's why you have to look at all factors and work on stomach lining and that kind of thing as well.
So then one last question. So there's some people, it's like, no matter what the heck they're doing, no matter what the heck they're eating or drinking, it's not going up. So what do you do for that person?
So if you've addressed all the things we've talked about, then I will, in some cases, recommend an iron infusion. For example, in that scenario where the hemoglobin was 80, I had just seen that woman. So that was the first visit or second visit. We got the results. So in that case, I was like, oh my goodness, her hemoglobin's 80. Let's, give her an iron infusion. So I recommended that she see a nurse practitioner who refers for that. And then she's got some good iron stores. You don't want to overdo iron infusions either, though, because that can be harmful for your kidneys. It can be overdone for your liver, because too much iron can be a problem too.
Absolutely.
I actually had a male patient recently who was, had large portions of meat, too much, and his iron was double. And it's not that he had hemochromatosis, the condition where you have too much iron. It wasn't that. It was more just the diet. So that too much of that can be harmful for your liver and your kidneys. So it's important to not overdo iron either. And it shifts depending on where you are in your life, right? How much iron you're supposed to have. So if you go into I'll put a link there, but the ods.od.nih.gov facts have, iron dosing for professionals and for people, depending on where you are in your life, how many milligrams of iron to get.
Awesome. Thank you.
You are welcome.